Thomas Cook is no longer Travelites by Travelites by Thomas Cook. Now they raised the spread. Lots of new construction going on.
Yeah.
Yes, this is a first city in Haryana state. It is nearer to Delhi, that's why it has been given as the NCR, National Capital Region. And most of the industries are getting concentrated here in this city.
In Gurgaon.
Yeah.
Yes. I can't figure out what is that called? Family. The son now runs it.
आपको रोटी करना चाहिए
वही मैं पूछता हूँ उसको कितनी देर लगेगी यहाँ अगर यहाँ इसको आधा घंटा लग गया तो आपका वो वाला ड्रॉप का क्या हुआ यहाँ ले लो छोटी गाड़ी में सो फाइनली आई एम वेलकमिंग यू अब प्लीज़ ऐसे मत करो आराम से घूमते रहो लगे कि हाँ ना
So, you know, Eladi's got a wheelchair on this department.
Yours is 40
I think I'm saying new, and it's not. Namaste.
Namaste, you are pronouncing right.
I would hope I would be going to the guest house tomorrow. Saturday. I would.
Yeah, this will come in your video. You'll be sitting like this.
Everybody want to get in the photo?
Yeah, everybody is happy to see you here.
Thank you for picking me up at the airport. Hello, Kuldeep. Anxious to hear your voice. Only email so far. Maybe I see you tomorrow.
Definitely you will be seeing
Dr. IPS O'Brien. Sound like I have an echo in here. So we are here at Artemis Hospital. My name is Fabio. They cut my hair. I used to have long hair, and I gained a lot of weight. You never heard of Fabio? No. Oh, yeah, famous singer and actor, yeah, in the U.S. Yeah, ladies like him. His name's just Fabio. No last name, but I joke. My name is Brian. I'm from the U.S. And the Artemis Hospital, a very, very high technologically advanced hospital. My room, wonderful room. Vaulted ceilings with molding, crown molding around the ceiling. Floor to ceiling windows. I've never seen a hospital with floor to ceiling windows. And I know the gentleman holding the camera, Mr. Kuldeep Chaudhary. Chaudhary?
Yeah.
Put the camera on yourself, Kuldeep. Take a bow. Take a bow. He is very, very good. He helped start this hospital 5 years ago. Say hi, Kuldeep.
Hi.
So he is my new friend here. I come by myself from the U.S. No family, but they are my family. Him and Yosh.
Hello.
And they take very good care of me. I'm in pre-op. I don't think they call that pre-op here.
Yeah, they call it pre-op.
They call it pre-op?
Pre-op
Okay.
and recovery.
And
is the
recovery.
same.
They'll come back here after the surgery. So I'm here to, well, I had them mark my foot to make sure they operate on the left side and not the right, because we know in the U.S. sometimes they don't do that, and the right leg gets amputated when it should have been the left leg.
In your case, left is right.
Left is right, okay. Anyway, yeah, that's the problem. They drive on the wrong side of the road here, just like in England. Anyway, the rooms are fantastic. Yesterday I got here early in the morning on Friday morning, I guess, from the airport. Came straight here, greeted very well, very nice reception. me to the room, went to sleep. The next day, Friday, during the day, I must have met with 9 or 10 doctors.
Yeah.
At least 3 orthopedic surgeons, I
Three
think,
orthopedic surgeons,
a radiologist, cardiologist, an anesthesiologist, and a regular doctor to see if he can help me get off all the pills that I want, all the Norcos and stuff, because I've been dealing with a broken hip for 5 months. Didn't know it was broken until a month ago, because my doctors, when I fell skiing 5 months ago, thought that I just maybe strained some tendons and ligaments. Well,
so they've already
in bringing those doctors back,
yeah, most of the doctors who practice here, they came back from the US.
because they have family here, and nobody wants to be away from family and where they were raised.
Yeah, and moreover, these doctors, they wanted the best of the technology which was not available in India. But when this hospital came up, now they're getting the latest technology to which they were used to in the United States. So that was the primary reason that they came back.
The MRI that was taken in the U.S. a month ago did not have as much detail as the X-ray that they took here yesterday morning. My left femur, which they were planning on doing a partial replacement, which partial hip replacement, which means just changing the ball and on the top of the femur, but leaving the socket alone, because the MRI report said that the socket was fine.
In technical terms,
It was not.
hemiarthroplasty.
They
which
couldn't see
planned
it.
earlier.
The radiologist in the U.S. misread he couldn't see the.
There wasn't enough information
Yes.
actually on the MRI.
So when the surgeon, after meeting with me yesterday morning and looking at the MRI on the CD and the actual films, he took another X-ray, thank goodness,
No, they would
and
have done it in
yes,
any case.
and they found a better X-ray, and they were able to see that the socket, which the U.S. radiologist thought was still good, the hip socket, was destroyed and had been destroyed for several months. So a month ago when they took the MRI should have caught that. And I will be talking to them about that.
It's do's and don'ts, okay?
Okay.
Okay.
Don't go out with fat chicks. It's no. And in the red circle it says fat chicks. Chicks is girls, you know. And a line through it. Higher than your hip. Yes. That means you're not going less than a 90-degree angle. So it doesn't matter what you're. That's difficult, because you have to have something to hold on to as you lower yourself. So of course that is what walkers are for, I guess.
I'm in the room 2401 at Artemis Health Institute. A patient, Mr. Kim Brian Erickson, who is flown from the state of California, United States of America, is about to be discharged today. He has undergone a total hip replacement surgery which has been done by Dr. I.P.S. Oberoi, one of the most renowned arthroscopic surgeons in India. Mr. Kim Brian flew into India about 8 days back. He drove from the airport straight to Artemis Health Institute, and the next day morning the surgery was done. Mr. Brian had sent his MRI reports from the United States of America, and on the basis of those reports, a semi-hip arthroplasty was planned. When he landed over here, seeing his discomfort, Dr. Oberoi had some doubts, so some x-rays were done. On plain x-rays, it showed that the extent of the damage was much more, and he, instead of a semi-hip arthroplasty, he actually needed a total hip replacement. Let's ask Dr. Oberoi, what exactly is the difference between the two procedures, and how difficult and challenging was this case?
You see, Brian, he had been in a hip damage for roughly 5 months or so, and he had been limping. The leg had become short quite a lot, and the pain and discomfort was quite extensive. The muscles had become weak, and as the time was passing over, the ball damage had actually hit into the socket, and there was a rent into the socket. So only doing a half hip replacement would not have worked. We would have need to do a total hip replacement, wherein we need to change the socket also and the ball also. And the surgery extent actually becomes nearly double, because instead of dealing just with the thigh part, we're actually dealing with the acetabulum or the pelvis part also. In addition, we had to restore the leg's length equally. The leg was short by around 5 centimeters or so, and the hip had actually climbed up quite high. And we had to bring that hip down and reposition it in a normal anatomical manner so that the hips are okay. If the hips are up and down, then your gait would never become good, Brian. And so that was a challenge. Second challenge was because it was lying quite high up, it was all surrounded by scar tissue. It's a fibrous tissue, which is hard tissue. It bleeds quite a lot. The moment you touch that scar tissue, it bleeds, because it is one which doesn't contract. Normally when you cut a muscle, it contracts and it stops the bleeding. But a scar tissue is one which is very hard tissue. So the moment you cut into the scar tissue, it starts bleeding quite. To bring and remove that all scar tissue, unless and until you remove it, you can't make the hip flexible. And then to change the entire socket, because the socket had rinked, so we had to bone graft that socket. And we were lucky, we got bone from the head of the femur, the thigh bone. And that head bone was your own bone, so it actually is compatible. So it heals well, it is 100%, it takes well. And then we fit in a socket, it's an uncemented socket. Now this is a socket which has got a calcium coating on it. So it's going to fix with your bone very well. And we, in addition, fixed it with 2 screws on.
Oh, okay.
So that's a well done socket.
Yes.
And into the socket we were able to place a polyethylene. So that's a poly cup, which is a very high density poly. You can bang over it, it doesn't break. So that's a high density poly which has been tested again and again.
Is it comes in the box with
It's come in a box. It's a
with
different
the
sizes.
balls
Yeah, different sizes.
It's
All
right matched to the
Absolutely.
diameter of the ball.
yeah, the outer diameter of the ball actually matches with the inner diameter. So there's no chance of it to dislocate. Unless until somebody just holds it and actually pulls it out, it doesn't happen in the normal.
And then there are how many screws
So
holding the socket?
usually the socket has 4 screw options to be put.
Holding the polyethylene plastic in.
Absolutely, but we tend to put only 1 or 2 depending upon. I mean, you were lucky, your bone quality was still pretty good. Maybe you were eating well and you were trying to manage well. Yeah.
Lots of good vodka.
Oh, maybe, yeah, that's a challenge. So, with the bone graft and your host bone, which was also good and healthy bone, we were able to fit the socket. We were able to bring your femur down, replace the ball, equalize your limb lengths, and were able to move your hip to the extreme range of movements on the table itself. So we ensured that you were able to do most of your activities which you want to do later in your life. Once you tend to develop good muscle control, and once you tend to develop a good power in the hips. Just replacing the hip is not the solution. We need to work out to make your thigh muscles better.
Sure.
If the muscles are weak and you have a new ball and socket, it doesn't work. You need to have good muscles. And then educated muscles, which means how to walk, how to bicycle, how to climb up, how to climb down. And this would be the next challenge now. We have to work hard on you, on rehabilitating you well. Because to get back into the way you were doing before, I mean, you are a skiing guy. You want to back into skiing.
47 years.
Absolutely. And that's another challenge. But understand, you learned skiing in so many years, and to become perfect, you start from zero now. We make you understand that the new hip has to understand
Same with walking too.
Absolutely.
Learning
Same
to
with
walk again.
the small baby needs months
Yes.
to walk properly.
Yes.
And it's something like it. You have a new hip now. You have to train your muscles. This is a hip which has to develop a connection with the brain. And that is why we give stick or a walker to walk, so that you don't fall down. You should have a good connection between the brain and the new hip. So with your commitment, which I see quite high, I think you should be able to work hard and get back to it.
So what's going to be the total recovery time when he can be, confidently walking on it?
6 weeks is the time when the socket calcium actually incorporates with the bone post-bone. Till that time we have to keep it protected.
Dr. Oberoi, you do almost 7 to 8 surgeries every day.
Absolutely.
But still I see that you get so involved, you're probably the only surgeon who goes into so much details about every single patient. How is this humanly possible? You know all about his skiing habits, probably all about his girlfriends also by now.
We brothers in previous lives, I think.
Maybe.
How do you manage this?
I don't know, but somehow it's quite interesting that till the time you don't discuss at length with your own patients, you don't expect that equal amount of cooperation from them, because they don't understand what has happened to their body, they don't understand what is being done to their body, and though they don't also understand what is the future, how the things are going to move. So it's very important for us to know the mindset, the physical condition, and discuss at length how the rehab part, how everything is going to.
Today is 6th of October. Brian is ready to fly back to the United States after a very complicated total hip replacement surgery. Brian landed in India on the 14th of September. So let's talk to Brian and ask him his experiences of the last 3 weeks that he's been in India. So Brian, first tell us, you met with an accident. What was it that happened?
Hello. It was snow skiing in the U.S. in California, near Lake Tahoe, and I unfortunately had a very bad fall, and I twisted my body to the right, but my left leg and the ski stay on, and it twists the opposite direction. If I was facing 12 o'clock noon, my leg and the toe of my foot went to maybe 7 o'clock. So it twisted, and I did not know it because my doctors tell me, oh, it's probably some tendons or ligaments or a bad sprain. But 4 months later, I was still under a lot of pain. I went to a different doctor, and he immediately came up with a conclusion that I broke my hip badly, and I had an MRI 2 days later on, I think it was the 15th or 16th of August, over 4.5 months since I fell, and he told me I would need total hip, or at least partial hip replacement of the ball, and they would put a titanium rod down in my femur, and excuse me, and then it would probably cost nearly $150,000 in the U.S. Being self-employed, I cannot afford my own health insurance, so I must pay for the surgery myself. But he said, shortly after telling me about the $150,000, he said he has had several patients, and he is actually a Chinese doctor, Dr. Benjamin Ling, in Placerville, California. He's a retired orthopedic surgeon, and he still is a practicing MD, but he does not operate anymore as a surgeon. But he told me that he has several patients that have come to India and have been very happy with the quality, which is the most important, but also the cost is very, very reasonable. He told me he recently had a patient come here and have a knee replacement, and it was less than $10,000. And so I got a hold of this person, Mr. Mark Visman, from Placerville, near Sacramento, California. And I talked to him over the phone, and he gave me your website, healthinindia.com, easy to remember. I immediately went to the website and I filled out your query, and you replied back within just a few hours and asked me for the MRI report.
Yes.
And then I emailed it to you, and it seemed like just a few hours later you had a response from Dr. Oberoi, Dr. IPS Oberoi, Chief Surgeon at Artemis Health Institute here in Gorgan, and that the price was going to be $8,500, $8,500 US for the surgery, the surgeon, 5 nights in the hospital. And then if you add the recovery for, say, 2 more weeks, with everything, I think we figured it was 11,500.
Yes.
So very, very reasonable. Less than 1/10 of what it would cost to have this done in the U.S. for just the hospital.
The surgery was done on the 15th, and after you had to stay there for a couple of days extra. You were discharged on the 25th. What was your experience about the hospital? The technical skills of the Indian doctors, the nurses, the language skills. Do you think you found it difficult? Any sort of?
The professionalism is not to be questioned. They're every bit as professional as any doctor, surgeon, technician, nurses that you would find in the U.S. The surgeons, the doctors, the technicians, the nursing supervisors, they all speak very, very good English.
Okay, Brian, so you got in touch with Health in India almost about 15 days before you came to India. It's been an association for almost a month. Did you feel any kind of apprehensions? You were traveling all alone. It was a very long flight to India. What to expect, going into a surgery with no family member around?
Well, I have traveled by myself many times, so traveling by myself is not a concern. I would imagine it would be with other people, but I only communicated with you by email, but I also had the testimony firsthand from a neighbor, this Mr. Mark Visman. Even though I've never met him, I've talked to him many times over the phone, but he told me how well you treated him, how well the hospitals treated him, and he had a wonderful experience here. He was here for more than nearly 2 months, I guess. Had several procedures done, one on each knee, and that helped. Having an American, that tells me the in and outs and what to expect was very helpful. And yes, and I want to reiterate that from the time I first learned that I needed hip replacement, and it was confirmed 2 days later by the MRI, exactly 30 days later, I was in surgery with Dr. Oberoi at Artemis. So I wasted no time in making arrangements and also getting my Indian medical visa.
That was, I think, the more difficult part than actually the
Yes. And fortunately, I was using American Airlines and their partner Lufthansa from Germany. I was able to get a ticket within less than a week. When I finally got the Indian medical visa, because it's very important to get that before you arrange airfare, especially before you put money out, unless it is a refundable ticket. Of course, they're very expensive, but most people would travel with a non-refundable ticket. So it's very important that you wait until you have the medical visa. But I got the medical visa. It took me several days of preparation, gathering documents. But I went to San Francisco, a 2-hour trip for me, and on a Friday morning, I dropped all my documents, my passport, everything they wanted, the letter from you, from Artemis, letter from my doctor in the U.S. stating that I would be coming here for a hip replacement surgery. Those items I took to the processing center for the Indian consulate in San Francisco on a Friday morning, and I wait around the rest of the day, and 5:30 that afternoon, I got a text message from them, from the consulate, that my Indian medical visa was approved and ready to be picked up. That was on a Friday. The following Wednesday, 12 of September 2012, I fly out and I fly to Denver, Colorado, Denver to Frankfurt, Germany, and Frankfurt to Delhi. And I arrived at about the 2 about a little after midnight, after I go through customs, your Dr. Yesh and Dr. Toran met me at the airport. As soon as I came out of baggage, they were right there with a very well computer printed sign with my name on it, and I waved to them, and I think that is, I have a video of that.
Yes.
And so they take me right to Artemis. I thought I was going to a hotel, but I was glad to know that the surgery had been moved up from Monday. I think it was scheduled for Monday the 17th. It was made 2 days earlier, the 15th. So because I have had already booked my return ticket home on 8 October, I was glad to hear that we'd be operating earlier. Then I would have more recovery time.
The doctor thought that you were coming after a very long flight, so it would be much better for you to be straight away into the hospital and under professional care, rather than spending maybe a day at the guest house trying to recuperate.
And I found Artemis Hospital to be, oh, the rooms are nice as a hotel room. Vaulted ceilings with crown molding, had an 8-foot sofa, so that if you do bring an attendant, they can sleep in the room with you.
Yeah,
In the U.S., they do not usually allow that. But here it is a very comfortable room, and I shower in the very nice big bathroom with a shower in one corner and no curbs or anything to trip over. The whole bathroom was the shower practically. And so it was a very nice bathroom, marble.
Even if people bring attendants, it's only the airfare which is the extra cost, because otherwise, in the hospital, one attendant can stay with the patient, and afterwards, even when you move to a hotel, one person stays with you. So the cost difference is not that much, except for the airfare. For lots of people, who are trying to save every little penny, it doesn't make a difference, because the kind of complete care that my team members provide, the need for an attendant, apart from of course the emotional need, is actually not felt by the patients. So,
oh yeah, I felt like you and your associates, I did not need anything. You were there in pre-op, you were there in post-op surgery, and you were as my companion, you and your staff. So it was very heartwarming. You treat me like family, and I will always be very grateful.
So, Brian, you've seen that, at least for the people who do not have an insurance, you can be a great motivator, telling them about, assuring them about the quality of healthcare that is available in India, and the huge cost difference, that exists because of so many factors. I would not like to go into them. And then India is a beautiful country. You are scheduled to, just after this interview, you are going for a trip to Delhi for some sightseeing and all, and I wish you had more days so that you could have explored India more. There are lots of beautiful places, the Taj Mahal in Agra. In South India you have Goa and beaches and beautiful things. So lots of people can, make it a holiday come treatment trip.
Yes, my goal in coming over here from the very start was I was not even considering doing any sightseeing. Having suffered more than 5 months with a broken hip and walking on crutches since the 2nd of April, my goal was only to come over here, have the surgery as soon as possible, recover, and then to go back home. My goal was just my trip, just to have the surgery. So I will come back to this country and see the rest of it in time. It is very beautiful. The people are very, very wonderful, and I will come back. I will be back, whether I need another medical treatment in the future or what. I will come.
I hope you don't need any more medical treatment. But
I'm not getting younger, so.
Yeah. it gives us a great pleasure. The first videos that we had, we saw you, moving out of the Indira Gandhi International Airport on a wheelchair, being pushed by an attendant, the flight attendants. And 3 weeks later, tomorrow you are about to board the flight, and it gives immense pleasure. You are off your crutches, your walker. The recovery has been remarkable. Yesterday when we were at the shopping mall, it was a great pleasure to see you dancing around. And can we have a look? I mean, if you will get up a little bit.
Sure. Yeah.
This was the hit that was
Yes.
operated upon.
You want to see the scar?
Yeah, maybe we would like to see a
I
side
guess you
view.
can always edit it out later for those that are weak. But
Yeah, this is where the surgeons cut it, and they
A 6
implanted.
inch?
Yeah, 6-inch scar was done, and they implanted the ceramic ball. They recreated the acetabulum, and there's a titanium shaft which goes into the femur. And the good thing was that they didn't have to use any cement, so it was an uncemented thing, which is going to last at least 20-25 years, which is a very good thing. And if you can walk a little bit now, and I know you've been walking very comfortably.
till when because my leg is because I still have some swelling in the muscles, so I will walk. It's a little. I still have a little bit of a limp, but it's a lot better than carrying a broken hip around.
So you don't need these things now.
No.
You can donate it
No,
to.
if I go at the airport, I will have them in case I need them, because I will.
No, obviously you're going to carry these back to the US, maybe use them as souvenirs
Yeah.
of those 5 months which you had so much trouble.
Yeah.
And this is pretty strong now.
Yeah,
You can put it.
Yeah.
You're putting all the weight.
yeah, I
on it.
can.
Stand on that leg.
Yeah, I can.
Yeah, as the doctor said, the recovery is going to continue for the next 3 weeks also. So by that time you'll gain enough strength with the exercises and the physiotherapy.
So I throw the crutches away.
Wow.
Well, I told Ashley. But you're not telling your parents
When you're planning to go,
tomorrow, Saturday.
he'll take you.
No, he wants to take Metro. I want to like to take Metro. I have to take a Metro.
Who only you?
Try and turn around.
What?
You're getting some?
What happened? I hear buzzing in my ear.
Here's your hip.
Oh, hip hooray!
Hey, you want to see over here? ये खड़ी सर
Brian, look here. So you are now about to go back?
I can walk now.
Wheelchair to Reliance.
A lot better than when I came in 3 weeks ago. 3 weeks ago Friday.
So you don't need these crutches now?
I just take them back with me. If I get tired, I get tired.
Yeah.
I get tired every once in a while.
In 1 month or 2 months time you'll be all right.
Yeah, I think so.
Yeah, you will.
So
So when are you coming back to visit us?
next time I need surgery or something,